Hi, I am Dr. Lata Bhat. I am a senior consultant, newborn specialist and a child specialist who is specially trained to take care of newborn intensive care problems and child development issues. I am working as senior consultant at Indraprasth Apollo Hospital, Sarita Vihar, Delhi, and I have my own child development center which is known as Palak Child Development Center at Mayur Vihar Phase 2, Delhi. Today I am going to talk about long-term health effects of a premature birth, which means babies who are born too soon before 37 weeks of gestation. These babies who are born too soon can have some immediate and some long-term health problems. So today we are going to discuss only about the long-term effects. In India, about 12% babies are born too soon and they can have ill health effects in the long term. Although we must remember that not all babies have problems, most of them are normal. Those babies who are born premature, like below 34 weeks, or the more premature they are, the more the problems. And if they are very sick in the newborn intensive care nursery, then they can have more problems. The only way to deal with the problems is to prevent prematurity and to take care of the problems earlier on in the newborn intensive care units and to detect the problems as early as possible and to give treatment. Does the premature birth affect the baby's brain? Yes, it does, and that is why they can have the long-term developmental issues related to the brain. They can have delayed physical development. They can have problem with speech and hearing. They can have problem with vision, problem with communication skills, and sometimes they have long-term disabilities such as attention deficit hyperactivity disorder. Can the preterm baby have long-term effects of lung problems? Yes, some of the babies, especially those born below 30 weeks, can have long-term breathing problems such as asthma, but many of these babies recover and only few continue to have the problems. So the only way to deal with the long-term effects of preterm birth is that the baby is delivered in an institution where there is proper newborn intensive care unit and a trained newborn specialist like the way I am, and the problems have to be detected earlier on by a person, a pediatrician who is trained to deal with the developmental issues of the children, and timely intervention will help prevent these problems and help the babies lead a longer and healthier life. Thank you. For any further queries, you can contact me on Lybrate.